want to discuss with you a trigger finger. I've had a request to discuss it. And a trigger finger is when you have one of your fingers contract downward. It makes a popping and clicking sound when you try to straighten it out from the tendon. What happens is your tendon in your finger becomes irritated and inflamed, and our muscle belly, so our tendons are what connect our muscles to the bone. So the muscle belly, then off comes the tendons, and then that's how it attaches to the bone. So a trigger finger is when you have done something that has inflamed that tendon, and now you have when you go to straighten your finger, it's hard to straighten it. Sometimes you can't fully straighten it. There's inflammation in there, pain. Sometimes you get a little bump. And it normally happens to females between the ages of 40 to 60 years old. In addition, it occurs a lot more frequently with a diabetic patient, and it occurs with repetitive use of something. So someone who types at the keyboard with their fingers flexed a lot of the time, a hairdresser gripping a comb or a brush or hair tools. And also my dad used his chainsaw and cut up a few trees. Took him a couple weeks to do it, and he ended up getting a trigger finger. So my dad was able to stretch his out a little bit, work with his. My mom ended up with a trigger finger from more typing type issues, and she ended up having an injection. So they can do a cortisone injection. Normally you need your primary care physician to refer you to go and see a hand specialist. So they can inject there and then get rid of that inflammation in there. So at home, things that you can do to help your issue if you notice that you're getting a contracture in one of your fingers or in two of your fingers. So there's obviously some stretching exercises that we could do. So we would use our table, just a small little table, and we could press down with the hand. Make sure the finger that is the culprit, the problem, you straighten it out on the table. And we can also lift those fingers up to stretch. And again, stretching, I like to perform at least 30 seconds, if not a minute, to hold those stretches. So just lifting those fingers up. And it's always good to run through each of those fingers that cause a problem. And again, holding those stretches for that good length of time so that we perform an active stretch. Stretching doesn't happen until we reach between 8 and 13 seconds is how long it takes a muscle to lengthen to its most lengthened position. Anything beyond that is a stretch. We can also get into some tendon glide activities. So you can just rest your arm on a little table. You're going to squeeze the fingers together. Then you're gonna wrap the thumb around tightly and extend. So you really wanna work those activities separately and make sure you get into that extension. Another activity would be gripping. So if you have a small ball, one of the grip balls, you can squeeze and release. Squeeze and release. Another activity is some strengthening activities. So you can take a nice little exercise band. You can place your fingers on a little table and just make a little circle, and you're going to extend your fingers out in that position. And that is your strengthening for that extension. It just helps to make everything balanced. So if you're more so this way, you want to really work on that extension. So the more that we can get the flexion and extension balanced, the better off you are. And of course, there's physical therapy things that we have the option of having, but if you're trying to do this at home, then this is how you want to treat it. Another really nice tool, it would be a modality that I like to use, and you can purchase one from the store, is a paraffin wax bath. That is where it's a little basin of melted wax, and you can use that. It's very good for arthritis. You can dip your hand, pull out. I like to dip 5 times. And then afterwards, wrap with some saran wrap, and then wrap with a towel, and you can leave that treatment on for 20 minutes or so, just to help release those tendons, relieve some of that pain and that stiffness in your joints. Hopefully you've learned something today. Thanks for joining.